name is Sandra Rodriguez, and I'm an occupational therapist. I've been doing occupational therapy for about 16 years now in early intervention, so it's quite a long time. But I love my job. I love what I do. It's super rewarding. I wouldn't change it for the world. And yeah, I just really am enthusiastic still, even after all these years, to be an OT. So I feel like doing it for so long, 16 years is a long time to do anything, but being an occupational therapist for that amount of time, you gain all of this clinical experience and you grow. So it's been a lot of growth, a lot of learning, and a lot of enjoyment as well. I knew that I wanted to do something in occupational therapy because I wanted to specifically work and help others. And I knew that I wanted to work with children. I've always wanted to do that even before choosing OT. And I just felt like occupational therapy offered such diversity in terms of how you can help children, how you can work with others. And what really resonated with me was mostly the independence piece. Was trying to, help these children gain developmentally independence in all areas of daily living. And the holistic piece of it all, just kind of really working on all areas and trying to help them become independent, whether it was play or feeding or dressing or grooming. That really kind of resonated with me. In terms of how we work together with other providers as well to support outcomes, it's really, especially in early intervention, it's client-centered, right? So every child has an individualized plan and specific goals that are tailored for that child and their needs. So it's very much client-centered, and we focus on those goals when we're working with children, and really try to help them get there as much as possible. I would say clinical excellence is probably the one that I really feel like, I can connect with the most, because I think as a clinician, it's a responsibility to really stay on top of evidence-based practice, to really understand the child and look at the child through a clinical lens, and stay on top of whatever new things are out there in terms of treatment planning and assessments. And I think if we can be really strong within the clinical realm, then we can offer the best part of ourselves as a clinician. I was collaborating with an OTA, an occupational therapy assistant, and we were trying to come up with creative ways to help this child who was severely impaired. And she was working on all of these underlying things to get the child to sit, to keep their head upright, to play, to engage in just their environment. And we were both, I was consulting quite often with her and trying to kind of help her get through to the point where she felt like, okay, this is working, we're doing something. And we were both really trying for this baby. And we decided that, instead of working on those underlying issues, that we can offer this child a different approach, which we decided to give her an adaptive piece of equipment, which was a chair that was tailored for her needs. And we went through the whole process of getting her the chair through early intervention. She was fitted for it. It was very personalized and tailored for her needs. And we started to sit her in the chair. The family started to get trained in it. And suddenly, things started to change. Like, she was engaging with her siblings, and she was able to feed herself. And, although we didn't quite fix the problem, but we brought something into her environment that really helped her become more independent. So I think acceptance, I mean, it's a really like broad concept, but I think just creating like inclusivity, right? Just really providing like a supportive environment where everyone feels valued and capable, regardless of their abilities, specifically in working with children with autism, right? And I think that like what it means for me as a clinician is really like honoring the pace and growth, celebrating progress in all forms, and just accepting the journey for that child and that family. The academic piece of becoming an occupational therapist, being in school, it's very difficult. It's not an easy program, and you know, I would say for people that are kind of like in the trenches and trying to get through the program and feel like they can't do it, you can absolutely do it. You can get through the program. It is, you know, there's a light at the end of the tunnel. If I did it, you can do it. And I think that, yeah, I mean, I would advise myself then to just kind of keep going and, you know, not give up and not let myself feel like brought down by the amount of work, the academic piece, and just enjoy the process of learning. We don't have enough occupational therapists out there. So I want to plug in a little piece of just advocating for my profession, and advocating for people that are interested in occupational therapy. It's a great career. It's incredibly rewarding. We need more OTs. I hope people are inspired by the profession, and hopefully we'll get some more people out there in the field.